Seri.
Seri, it means gray.
Gray.
Litmus test. Reaction, yes?
Acid.
Sour, kислый sour. Shape is normal, formed. Occult blood test, negative. Stercobilin test, also negative. Normally we should have stercobilin in feces, yes? Consistence. Мазевидный, it mass is ointment, yes? Мазевидный pasty. So, mucus, да! Please take a seat. Mucus is absent, blood is absent, pus is absent, food particles also absent. So, microscopy. Striated muscle fibers absent, non-striated muscle fibers 1+, connective tissue absent, neutral fat also absent, fatty acids 4+. It means very, very much. Yes? Soaps also absent, starch extracellular and intracellular also absent. Digestible plant fibers absent, non-digestible plant fibers 2+. Iodinophilic flora absent, leukocytes, erythrocytes absent, helminths, ova also absent, and protozoa also absent. What findings do we have here? First of all, the negative reaction on stercobilin. Stercobilin test is negative, and a lot of fatty acids. What does it mean?
Bile obstruction, bile duct obstruction.
Yes, we don't know about obstruction methods. Maybe it's a tumor of pancreas. It's obstructive jaundice. Yes, mechanical jaundice. Yes, and why do we have fatty acids? Because we have no bile acids. Yes, in the bowel. So the right answer is the mechanical jaundice. So the next, you will have such analysis certainly. Number 2, also color is
Gray.
Seri. Yes, gray. The reaction is alkaline, slightly alkaline. Yes. Shape is normal. Occult blood test negative. Reaction also negative. But I think it's the same as the previous analysis, with one exception. We have here, besides fatty acids, also neutral fat. What does it mean? That we have, besides the mechanical jaundice, we have a pancreatic insufficiency. Yes, because the neutral fats we see if the pancreas doesn't produce ferments. Yes.
This one is absence of lipase?
Quite right, quite right. What may we have? Possibly a tumor of pancreas. If we have a tumor of pancreas, we may have as well a jaundice, obstructive jaundice, and we may have pancreatic insufficiency. So, okay. Number 3, the color.
Can I ask you something? This tumor of the pancreas can be located on the head of the pancreas,
quite right.
It obstructs the
yes, yes. And the tumor pressed on the bile duct, and we have jaundice. Number 3, the color is brown, the reaction alkaline, the shape is normal, occult blood test negative, stercobilin test positive, consistence soft, yes, mucus absent, blood absent, pus absent, food particles also absent. What we have on microscopy, striated muscle fibers, plastid means layers, several layers, non-striated muscle fibers absent, and connective tissue also layers. We have no neutral fat, no fatty acids, a small content of soaps, a small content of starch, digestible plant fibers also layers, iodine philic flora. You sometimes give a wrong answer. Your conclusion may be that is pancreatic insufficiency, but if we have pancreatic insufficiency, we should have neutral fat. This is deficiency of gastric acid.
Yes. And can it also be increased motility of a small intestine?
Maybe, but it may be a combination of gastric absence of gastric acid and increased motility.
Because of the starch, I mean.
Yes, yes. But usually it's enough if you say about absence of gastric acid. Number 4. Excuse me. Color light. Litmus test slightly alkaline. The shape is normal. Occult blood test negative. Stercobilin test positive. Consistence also pasty like ointment. Mucus, a lot of mucus, 3 pluses. The blood is absent, the pus is absent, food particles absent. What do we have here? A lot of non-striated muscle fibers. We have neutral fat. We have fatty acids. We have non-digestible plant fibers, but also leukocytes and also erythrocytes. Also, we have 2 syndromes, yes? First of syndrome is pancreatic insufficiency, because we have a lot of neutral fat, but we have an inflammation, inflammation in the bowel.
Like
maybe
ulcerative colitis.
Yes, maybe colitis. Okay. Number 5. The color is yellow greenish. Yes. Litmus test slightly alkaline. The shape is fluid. Yes. Non-formed. Occult blood test positive. Stercobilin test positive. The consistency is fluid. The diarrhea. Okay. And a lot of mucus. Straight muscle fibers, 2 pluses, neutral fat, жировой detriment, it means we have degraded fats, yes, a small number of fatty acids, a lot of soaps, a lot of starch, and we have a lot of digestible plant fibers, and also leukocytes, erythrocytes, and a lot of cylindric epithelium. What may it be? I think it's first of all inflammatory bowel disease, maybe ulcerative colitis or morbus Crohn. So Number 6.
Can I ask you something about the Mila soaps?
Yes.
What does it mean in this case?
It means that soaps is a product of fatty acids
Okay.
and of neutral fat degradation.
Okay. Thank you.
Yes. They confirm that we have a neutral fat. Number 6, a little bit gray, the color. Slightly alkaline is the litmus test, the normal shape, the negative acute blood test, the positive stercobilin test, also a pasty consistence. So what we have on microscopy. You had already seen such analysis, a lot of non-striated muscle fibers, a lot of neutral fat, fatty acids, and starch. Also pancreatic insufficiency. Yes. The number 7, I saw very often such analysis on today's exam. The color is black, yes. The litmus test slightly alkaline, non-formed, it means diarrhea. Occult blood test, sharp positive, yes. Stercobilin normal. The consistency is also fluid, the diarrhea with black feces. Microscopy, a little bit muscle fibers, also soaps, and digestible plant fibers. What does it mean?
Hemorrhage?
Yes, usually we say upper gastrointestinal bleeding, upper, not lower parts of bowel. So because the black color of feces, yes. So, and the last one, microscopy. The color is brown, slightly alkaline. The form is normal. Reaction on blood, acute blood test negative, stercobilin test positive, consistence soft. Here it's a very difficult analysis. Why? Because it's a normal analysis. You will have a normal analysis of feces, of urine, of blood. So